Wendy, I have to ask you, how's Yogi?
Oh, Yogi. He's so okay. He's amazing. He's my little baby. Born
Your fur
April,
baby.
my fur baby. He just celebrated his 5-year birthday.
He's a long-haired dachshund. He is the cutest thing in the world. And I say that very personally because, every once in a while, audience, I get to have a guest on the show who I not only admire professionally, but happen to know personally. And today's one of those days. So I not only know Wendy Lund, who is the Chief Client Officer at Health at WPP, but I also know her kids. She knows my sister. But more importantly, Wendy, you are a force in
Wow.
healthcare
Thank
marketing. And
you.
that's really what we're going to talk about today. Hey, it's E.B. Moss, and this is episode 36 of Insider Interviews, Season 2. And you'll get the insider scoop on the business of media, marketing, and advertising. Today's scoop is from Wendy Lund. She's the Chief Client Officer at Health at WPP, and we're going to talk all about marketing women's health. Now, Wendy and I go back a long ways, but she has been a powerhouse for even longer, from leading GCI Health for over a decade to her current role at WPP. And in between, she launched a groundbreaking women's health initiative at Organon and led her own podcast. She worked at Planned Parenthood and, with my sister, at National League for Nursing. Wendy is quite the expert and quite passionate about women's health, as you'll learn in this episode. And I'm quite passionate about her dog, Yogi. Anyway, here's Wendy.
And if we spent the entire time talking about Yogi and how he helped me get over my fear of dogs, that would be a good thing.
Okay.
And on your sister, she's one of my best friends forever and ever and ever, which brought you into my life, which is
Yep.
great. So I'm happy to talk today.
Thank you. So actually, where you met my sister kind of sets the tone for what we're going to talk about. I don't know if this was your early stage career or not, but it was at National League for Nursing, right?
Right.
Yeah.
Yep.
You were a baby.
Baby. Still in diapers.
Yeah. And now you've gone on and you really threw yourself into the whole business of women's health. You have your master's in it. You've worked in pharma. How did you end up in this path?
So interesting that you ask and talk about it. Yes, your sister did play a role in my early part of my career and my entire life. Lisa, we'll give her kudos. She's amazing. I love her.
Lisa Calderwood.
Lisa Calderwood. I still call her Lisa Moss. But yes, so early in my career, while I was still wearing diapers, I was the head of marketing at the National League for Nursing, and she was the head of communications. And it's just interesting how our roles intermingled because I was really support for her as she was doing all these different projects and things. And so I think what kind of brought me to this women's space is a couple of things. One is, like you mentioned, I have a master's degree and I really doubled down in women's history, which then brought me to women's health. And then also the fact that women make up the majority of nurses. So I felt like as we were fighting for nurses, we were also fighting for women. And they were really the directors of all the health that were happening in the hospitals and in the home, et cetera. And so women, they're the chief medical officers, right? Mm-hmm. So that brought me to Planned Parenthood. And Planned Parenthood, I had done volunteer work for years and years with Planned Parenthood. I would table in the streets, bring out information to birth control for people that didn't know much about it. These are the days where we didn't have online. It was like handing out pamphlets and brochures and papers and this and that. I would have taken a job doing anything at Planned Parenthood. Like you could have had me like sweeping the floors. It would have been whatever it was, but I was so lucky. I was made the VP of marketing there. And that was really the golden ticket for me in terms of working really hard, learning everything I could, and really, really passionately focused on women's health. That kind of gave me that start. So Lisa was definitely a step into that because she and I saw the world the same way. We got pregnant at the same time. We had our first babies. Your lovely
And they are
Daniel.
now besties, those two babies, my nephew and your daughter.
Well, the little babies, the bigger babies, not as, they're doing their own thing. But our little babies, yes, they are inseparable little babies. They're adorable.
Well, you just came back from South by Southwest, and you wrote on your LinkedIn that there were 3 key themes that really stood out there. And at those sessions, what jumped out around women's health for you were innovation, information, and imperative. So I figured that, Wendy, we would bucket our conversation around those three things. And you being you and innovating ever since the early Planned Parenthood days. I want to start with innovation. Now, this is also a B2B podcast. So I want to talk about one of the things that you said, which is, and I'm going to read this, that you said women's health is an investment opportunity, not just a cause, and women deserve new treatments and technologies that it just makes good business sense. Tell me about that and all of that.
Yeah, no, thanks for reading that back. So innovation is so critical in the women's health space. For years and years and years, women have been left behind. We've been underdiagnosed, underrecognized, undertreated, under whatever. And, now is a really interesting time for women's health, and that more and more people are taking note of it. So if some of the organizations that I've worked with and kind of been party to, there's so much innovation going on in these organizations. Last week, I had dinner with somebody who has created a product around neuropathy for women who have had breast cancer, right? I mean, this is a big issue for people that have cancer, not just women. And getting the funding is next to impossible. It's so tough. And there's so many things going on out there that really deserve this kind of funding. So my call to action, I guess, is to the business community and to the investment community to see these innovations as something that's not just going to be kind of a one and done, but something that will be here for the long term that could revolutionize the way that we really support and treat women across many conditions, many diseases. So this is a big, big area for me. And the other call out I'll have is I had a meeting a few weeks ago with a major consumer brand, and I had this massive aha in the middle of it, because these consumer brands that are focusing on fitness and wellness and self-care for women, they also have a huge opportunity to bring innovation to life for women around mobility and other issues where women are really struggling and suffering as they're getting older. Menopause, huge issue, right? In terms of where there could be huge innovation. So my hope and my goal is that we don't allow our environment around us to set us back, but actually to propel us forward so that we can really push those in the business community to focus on innovation, and not just for innovation's sake, but for the sake of women and their future.
Thank you. I think thank you on behalf of all women too, especially during Women's History Month, I should say. Yeah. So let's drill down a little bit about some of the biggest opportunities for innovating in women's health. If we talk about fitness, nutrition, health care, pain management, what are some of the businesses or the business opportunities that companies might be overlooking?
I think they go across everything. So, there are opportunities, like you just said, mobility, pain, menopause, birth control. Like, when's the last time we saw a new birth control method come out? I think it was the pill going over the counter a year ago, right? Are women engaging with that? Are they embracing that? Are companies willing to kind of take the next step in terms of women in birth control and what's next? Fertility, right? That's had a lot of innovation in the past few years, where it's gone from challenges around diagnosing to actually being able to test by, saliva, et cetera, et cetera. Diabetes, with CGMs and the focus there in terms of how to innovate around those, get more people wearing them. Even things like glucose management systems that exist now that didn't exist in the past for people like you and me who may not be pre-diabetic, but who really want to understand and manage glucose. So the list is kind of endless. There are thousands of these smaller innovations sitting out there. And what we need to do is elevate them to the importance that they need to be, so that companies, pharma companies, med tech companies, diagnostics companies take this really seriously and do something with this.
Because you have worked at a communications agency promoting healthcare. Certainly, you've been at WPP, Organon, WPP. So you've seen a few sides of it, including on the pharma side. What about mainstream companies? How can they support promoting awareness of women's health issues and innovation?
I think, there's probably three opportunities there. One is obvious, which is seeing these innovations and acquiring them, right? And taking being able to scale them, because these smaller companies don't have the scale to be able to deliver them to where they want to be. So that the acquisition piece becomes a real interesting positive for women in general. The second piece is obviously investing, right? Just putting those investment dollars and encouraging others to invest in these companies to help them grow. And then the third, which I know we're going to get to, is around information. The
Yeah.
more the companies can really talk about these areas, some of the companies lately, one of the things they've done a fantastic job on, and I feel like we're going to see more of that in the next few months, is around hot flashes. Most women, up to now went through menopause with very little information. They had no idea what a hot flash was. They were very embarrassed by these things. It stopped them in their personal life and their jobs, et cetera, et cetera. And now, because drug companies are speaking more and more about this, we're going to get more and more women educated around these topics and using these products. So it's a win-win for everybody.
Fantastic. And, me being the social media consumer that I am, I don't know if you saw this video. I'll try to add a link to it. Not everybody has TikTok these days, but there is a viral video of a woman at a football stadium, I think it is, and she is having a hot flash. And she's sitting there in the stands on a freezing cold day. She happens to have very short cropped hair, and you can literally see the steam coming off of the top of her head. So
there's so many out there like that too. And celebrities now are talking about this. But at the end of the day, just to kind of pivot to communications for a minute, which I know we're on innovation, when we did research last year called Health on Her Terms, what we found is that while women love celebrities and the fact that they're coming out and talking, they really want to see people like you and me talking about this and sharing what they have and haven't done to manage these kind of symptoms.
Yes. Better living through sleep aid is my approach. So when you were at Organon, I want to talk a little bit about innovation. You launched a podcast there. You certainly appear on podcasts. And you also spearheaded a big PSA campaign for World Contraception Day. What did you learn about trying to create breakthrough moments, about innovating in healthcare communications through projects like that?
I am, first of all, so grateful to the CEO of Organon and everyone who was there and my team for what we were able to accomplish over those 2 years in the middle of a launch, in the middle of COVID, where, we were very limited in what we could and couldn't do. And we really kind of put a whole new lens on it. So the first thing was around listening. So what we found through our research was that women were doing a lot of talking, but nobody was really hearing what she was saying. And when we went out, when we launched and we said, tell us one thing you'd like to see happen in women's health, we got thousands and thousands of responses, and some of them were so simple, like, back to menopause, like managing menopause, or thinking about menstrual pain, or things that were just simple that still in 2023 or 22, when it was, still had no cures for these things, still had no treatments for these things. So I think the biggest learning I had, and I've really carried that back over to the, holding company and agency side, is listening to our audiences and really understanding their needs and putting patients at the center. And maybe it's not even at the center, but it's at the forefront of everything we do. Mm-hmm. And I think that sometimes gets lost in the melee of trying to do, healthcare marketing, because we're so regulated and because, everything's about how to stay within guidelines versus how to make sure that people are engaging with content and understand the content, and then that they feel that they have a voice to tell someone else. Yeah. So, appreciate you asking about all that. Every single one of the campaigns we did was very successful. The team was amazing in terms of how we, to your point, use social media very, very extensively, but we did it all within compliance, which was the best part. So.
Well, I've always found or felt that podcasts would be a good opportunity for staying within the compliance of pharma, because you can have show notes, you can link to things from the content. And I know that disclosures can take up, 40 minutes of a 45-minute podcast if it has to be verbalized. So what are some of the challenges and opportunities in media channels for healthcare messaging?
So what I loved about our podcast was that it was 100% focused on what the needs were of women that we had identified previous to, and we got experts on that people had very little exposure to. So that was a real plus. And I think the number one learning was no politics, no products. So that kind of took all of like the legal regulatory piece out of it and made it easier. And then really for me, as you are an amazing podcaster, but me learning that it's more about the listening piece than the talking piece. So, it was in many times where I wanted to have a conversation, we could, but mostly I really wanted to take those 20 minutes with the person I had on as my guest and make it their time, not about my time. So, excited about, what we can do in the future with this. I still think there's a lot of legs to do with this, especially with what's happening down in Washington and how we can really help marketers understand what's happening right now with the administration so that they can maintain their great grit and their understanding and their excitement around doing healthcare marketing.
Fantastic, Wendy. And I will sing your praise for one more second before we move on deeper into information as the second bucket. But you are up for an award. This will publish in March of 2025. And I think in May, you're going to receive the Pinnacle Award from MM&M for all of the fantastic impact you've made in healthcare marketing. So I wanted to talk about that and congratulate you.
Thank you. I appreciate it.
So that's on the innovation side. On the information side, paging Dr. Google, back to some of the challenges. Do you think that social media is a help or a hindrance for moving awareness and information about women and women's health forward?
Definitely both. I think, on one hand, it has expanded and exploded the amount of information women have available to them, which they really needed. When I look at my daughter, where did she find information out about birth control? Yes, her mom, who's very obsessed with making sure my children have everything they need, especially in that area, but also through Google and all the other means. And there's so many good websites right now that are up and so many good social channels that are out there for younger women in particular that I say this is a positive. The negative is when the information is incorrect and inaccurate. And that was our focus at South by Southwest, which is focusing on misinformation and inaccuracies that exist. There's so much fake news out there right now and so much fake information out there. We just want to make sure that women have the right information for themselves as they're not only taking care of themselves, but taking care of their families. And there's a lot of information women aren't aware of, since the goings on of the last couple of years, maternal mortalities are up, infant mortalities are up. I mean, these are things that people need to know about, and they need to be accurately shared online so that people can take care of themselves and protect themselves, but also advocate for other women. So there's lots and lots and lots of positives. I don't know how we would live without what we have, but we also need to be wary and careful that we need to make sure we're finding information in sites that are accurate and really have plausible, credible information.
And you've also said, I think you mentioned this at South by as well, that men can be good allies too in women's health. So what's an example of an actionable step?
I will say men are the best allies, and they are underestimated in what they are capable of, because I had two experiences. One, obviously, at Organon, where half of our staff was men, and getting them to embrace and be excited about women's health was a big, big effort on our part, meaning we were very committed to it. And I have never been more moved in my life as when I heard men talking about the things they were doing for the women in their lives. It was just, my heart was just cracking in half, just so proud. Taking their moms to the doctor, taking their wives to mammograms, taking care of their women when they weren't feeling well, telling their women to take care of themselves, looking after their daughters and making sure their daughters had birth control. That was one of my favorite ones. We're in a different world, now where we are right now in terms of what's happening. And so men can be even bigger allies and advocates. And I believe that men are hugely important to the women's health movement and areas that we're in. And every time I see men in an audience, I am so excited. I usually point them out and say thank you. And, they're like embarrassed. But I also ask to hear from them because I want to hear from them too. And, little things like, I'm going to watch the kids while you take a walk because I want you to be healthy and track your steps. These are little tiny things that can go such a long way for a woman's health, or tracking when a woman's mammogram should be, right? Yeah. Like, oh, you had your mammogram last May. Well, it's June. Where's your mammogram? These are things women actually, I think, are a little like, wow, that's kind of weird that my husband's talking about my mammogram, but at the end, or their partner, but at the end of the day, these are the ways to keep women healthy.
I think that's great, Wendy. And I am not outing you in any way because you wrote about this on LinkedIn quite movingly about your husband's cancer diagnosis a few years ago. Love your husband. And you, as we said, know my family and my family's history with cancer. And you wrote about the fact that cancer will touch everyone at one point in their lives, whether it's people that we know and are good friends, or ourselves, people we have to care for. I'm always pushing my friends for their colonoscopies or their mammograms sooner rather than later. You hear that? But how can we do a better job at communicating the fact that 1 in 2 men, 1 in 3 women will get cancer in their lifetimes, and we have to be proactive? I feel like we're so often ostriches about our own health care. What are some ways that we can drive the information forward?
I think to your point, it's on everybody to help each other, right? So you just pointed out these enormous stats that cancer, while we've had these incredible medications and progress, the diagnoses are going up and they're also going younger. And so we really have to be diligent about this. And I think what you just said, like making sure that your friends and your family are going for these tests. We know that breast cancer with mammograms, like high percentage of this is preventable. Like we would be preventing so many more cancers if women went for their mammograms. There are tools now for colonoscopies, right? Where you can actually do, if you're like less at risk, you can do it in your home and do like a screening. This is on the physician, the nurse practitioner, the friend, the mother, the family, the father, the kids, and everybody to support each other to make sure they're doing these screening projects. They sound like projects, but they're not projects. Just go out and get screened.
Yes. But I think that Health at WPP also did a really cool collab with Nextdoor. Mm-hmm. And you tried to create better connections for cancer patients and their caretakers, et cetera. Did I read that right?
Yeah. So what we did was basically partnered with them, and Nextdoor, we actually have like a partnership with them where we're coming out with content like throughout the year. And one of the things that's so unique about them is their legs into the community, right? Like we are really focusing more on our clients and large companies and small companies and medium-sized companies, but we're there focusing on people who are on the ground. And we thought this was a very cool thing. It was this whole idea of like your neighbor could have cancer and you have no idea because this is a very stigmatized area. So let's rip the Band-Aid off, talk about this more, and encourage people to talk to their neighbors, talk to their local communities about cancer, to learn more, to drive more progress in the area, and then of course to drive prevention and treatment.
And I'll also use the phrase open kimono. I think that, it's not just getting us to talk about it, but being okay with talking about it. It's challenging. So, you being a world-class marketer, what are some tactics that we can use? I mean, storytelling, things that, help get that information out there. How do you as a marketer recommend companies and others approach it?
I mean, certainly it comes back to some traditional marketing tactics and things that we all learned very early in our career around insight and strategy and making sure that we have both before we go off and start blasting people with tactics. At the end of the day, how are we really focusing on HCPs, healthcare professionals? How are we focusing on patients? What about their caregivers? So I think the areas we've spent most of our time in is 1, the HCP, 2, the patient. Very limited time is being spent on caregivers. I would love to see companies over the next few years expand that aperture and spend a lot more time focusing on the people who are giving care. My mom, as you know, she just passed away last May, and she had dementia, and it was severe dementia. And when I actually recognized that my mother had severe dementia? When I saw an ad on television that showed, you probably have seen the ad with the daughter and the mother's being really
She gets
hostile.
angry.
Yeah. That's when I the light bulb went off, where this was after she passed away, where I was like, my mother was struggling with this for a very, very long time.
Oh, my Lord.
And I likened it to her being my mother, right? And just being like annoyed that I was trying to like manage her health and do these things and this and that. So that was a big awakening for me in terms of DTC advertising, as I've, been involved in this industry for so many years. I remember the first DTC ad ever launched and how important that ad was, that these ads can have major impacts on people. So it's all about, to your point before, using social the right way, using direct to consumer advertising the right way, just making sure we create that omni-channel approach, which is probably a little dated in the world you live in, but still being very much embraced in the world I live in, to make sure we're getting our messages to the right people at the right time in the right place, so that they'll actually take an action.
Right. Back to my sister, she works in patient education, and, what they have to do to help the doctors better communicate to the patients in a way that's clear, tangible, encourages them to take action, or what you read on, your medical device when you're at home and you're trying to figure it out.
Right.
So all of that messaging is just so important. And I loved your example. I'm sorry for your loss, but I loved the example of, how we can learn.
Yeah.
On to our third bucket, which is imperative. And I think it's pretty self-evident now that, you're pretty passionate about saying that women deserve new treatments and technologies. Are there other business opportunities in women's health? How can, a quick service restaurant or a automotive company, how can more companies get involved in messaging around women and health?
I always say health is everywhere and everyone cares about their health, right? At the end of the day,
yes.
It's everything, right? So those companies that you just mentioned, whether it's food or whether it's CPG, they have an enormous role to play. And they have a little bit of an easier role to play because they're not really pushed in by guidelines and, legalities. I mean, legalities maybe, but they can really do so much. I mean, if you think about a restaurant.
They can't push a drug without compliance talk, but they're not going to do that.
Right.
Yeah.
So you think about a restaurant, right? And people are struggling and suffering so much with immunology issues today and inflammation. When you do an inflammation-free menu, and I bet you people be flocking there, or diabetes-free menus. We did that years and years ago for a client, and people love this, because of the food. We did a food truck that was a diabetes food truck. People loved it. So food, I think, especially right now with everything happening in the world, with, the culture we're living in, I think having those food opportunities, 100%. But even getting into sportswear and sports and self-care and the CPG side, I could name for any company you come up with a health-related thing. And I'll tell you one example that I just loved. And I do think that every company has an opportunity to think about health. Ford Motor Company introduced a seatbelt for women who have breast cancer. And after you have a breast removed, it's very painful. And then you have the seatbelt kind of digging in. Mm-hmm. And they created a seatbelt so that women who had breast cancer, could wear this. And I was like, this is the coolest innovation, right? Yeah. But they were really thinking about it. And I love when I see companies who are spending and investing so much money in women and their health. Not because they have to, because they want to. And that's really, really important. It wouldn't matter if they ever did this or didn't do it. People weren't clamoring and saying, you must do this. They thought one person probably thought of this in the middle of the night and came into work and said, I had this idea because my mother's struggling with breast cancer and I'm seeing this thing happening. And it gets back to the traditional thing, EB, which is insights are everything in our business. And having those insights around patients is so critical. So my imperative, what I meant by that was, one, companies need to stand up. This is a critical time for companies to be in the camp of women, whether it's coming out with new treatments, whether it's making sure their HR policies are up to snuff in terms of what women need around all of their reproductive and women's health needs. But at the end of the day, everybody has a role to play here. And I really hope that, people will push forward and not just sit back on their heels hoping that someone else is going to do it. So that's the imperative.
So apropos Ford, one other thing you said is change won't happen unless we actively drive it, and we can't afford to wait. Wendy, thank you so much for all of this wisdom. You dropped on us the info, the imperative, the innovation. I just love talking to you, whether it's at a family gathering or here on the podcast. Thanks so much for joining. Any final thoughts, any recommendations?
I just want to say, Evie, thank you for your inspiration. I really appreciate it. Thanks for having me here. I adore you and your family. And it's just been a lifetime doing this, right? So it's just something that I'm going to continue to do till I don't anymore, which probably will be never. And it's just so great to know that there's so many people that feel the same way, and we all have collectively an opportunity to make a difference.
Thank you, Wendy. Well, I hope you got some good insider scoop from this episode of Insider Interviews with me, E.B. Moss. If you enjoyed this content, please feel free to buy me a coffee at buymeacoffee.com/mossappeal. If I can help you with your company's podcast, please find me at mossappeal.com. And I hope you'll follow Insider Interviews on social media and let me know if you have a question or a suggestion for a next stellar guest in media, marketing, and advertising. Speaking of stellar, my theme music was composed and performed by the incomparable Grammy-winning John Clayton. Thanks again for listening.